Utility of diffusion tensor imaging in predicting outcomes following the surgical treatment of degenerative cervical myelopathy. Dr. Pratyush Sahi from Kolkata reports a prospective cohort study in the April issue of Neurology India. They included 66 patients who underwent surgery for degenerative cervical myelopathy. They concluded that preoperative fractional anisotropy was significantly lower in patients with the poor outcomes. As we know, degenerative cervical myelopathy is a currently term used for myelopathy related to the cervical spondylosis. There is always a dilemma that whether it should be managed conservatively or it should be operated. We need to have the more clear prognostic indicators which may guide us that which patient would be having a good surgical outcome. Previously reported predictors of the surgical outcomes are the age, duration of symptoms, preoperative Japanese Orthopedic Association score, anxiety, gait impairment, and smoking. On the MRI, T2 weighted diffusion imaging is used commonly, and intramedullary signal intensity, grades of compression, and area may predict the degree of improvement following the surgery for degenerative cervical myelopathy. Now, in the T2 weighted MRI, the important parameters which are used are the CR or the compression ratio. This is determined by measuring the anteroposterior and the transverse diameter at the most compressed level of the spinal cord. Typically, compression ratio decreases with compression. TA refers to the total area available for the cord in the axial image at the most compressed level, which also decreases with the compression. Some studies have indicated the clinical significance of TA and the CR as a predictor for the outcome. Now, another parameter used in the T2 weighted imaging are the signal intensity. This also has been reported in the different studies that it may be useful. Now, high signal intensity in the cervical spondylotic myelopathy may be a poor prognostic factor. However, some authors conclude that the high signal changes on the T2 weighted imaging seen may be a multitude of the conditions such as the edema, inflammation, vascular ischemia, gliosis, or myelomalacia. Hence, it may be non-specific. They suggest that ratio of the SI values rather than only signal intensity would provide a better objective measurement. Now, this SIR or signal intensity ratio is obtained by dividing the signal intensity at the level of the maximum compression by the signal intensity at the level of the C7T1. Many authors have reported a correlation with the outcome. Now, DTI or diffusion tensor imaging is an advanced MRI technique. It detects the microstructural tissue changes by assessing the presence, strength, and the directionality of water particles. Now, in this DTI, usually examined are four parameters. One is the ADC or apparent diffusion coefficient. This represents the diffusive strength of the water molecules regardless of its directionality. Consequently, ADC values tend to increase in area of the spinal cord compression. Now, another one is the FA or the fractional anisotropy. This measures the asymmetry of water molecule diffusion, which is based on axonal structure. Now, a decrease in FA indicates a loss of anisotropic water diffusion, suggesting damage to the fiber tracts seen in the spinal cord compression. Then another parameter is RA or that is relative anisotropy. That compares the magnitude of the anisotropic part of the diffusion tensor to the magnitude of the isotropic part. Fourth parameter is the VR or the volume ratio. This is indicated of ellipsoid volume in comparison with the sphere with radius equal to mean diffusivity of water protons. Now VR increases and RA decreases with increased damage to axons due to compression, as reported in the various studies on the diffusion tensor imaging in degenerative cervical myelopathy. In this study, their main objective was to assess the usefulness of DTI as a prognostic tool in predicting the neurological recovery, and they conclude that they divided into two groups equally, and they found the statistically significant difference in that preoperative FA or the fractional anisotropy was found to be significantly lower in patients with poor outcome. Now, preoperative RA or relative anisotropy was also found to be lower. However, this failed to reach the statistical significance.